Welcome everyone to today's webinar for Memphasys Reproductive Technology, ASX code MEM. The presentation will be delivered by Managing Director, Dr. David Ali, together with Memphasys Head of Research, Distinguished Emeritus Laureate Professor, Dr. John Aitken. Together, they will provide an overview of the company's activities and future plans. At the completion of the presentation, the presenters will participate in a Q&A session. So as the presentation is progressing, if you do have any questions, please submit them in the Q&A box on the bottom of your screen, and I will put them to David and John during the Q&A session. Without further ado, I would like to now introduce Managing Director, Dr. David Ali, together with Memphasys Head of Research, Distinguished Emeritus Laureate Professor, Dr. John Aitken. David and John, over to you.
Right. Thanks very much, David, for your very kind introduction there. And thank you, everyone, for joining this webinar today. As David has said, my name is Dr. David Ali, and I'm the current CEO of Memphasys. And to be honest, I'm very pleased to be presenting to you today. Please note that this presentation has been previously released to the ASX, and thus I will try to move through it very quickly to save some time at the end of the presentation so that you can ask questions, and we'll endeavour to answer them in the best way we can. Next slide, please. This is our disclaimer. You're quite welcome to read this when convenient. Slide, please. For those of you who are new to the company or may not have followed our story or been absent from our story for a while, I'd like to reiterate and give a brief introduction around MEM. Next slide, please. There are a few important points that need to be mentioned about this company, Memphasys. Whilst we have a healthy pipeline of products, it's important to note that our flagship product, the Felix system, is currently being commercialized and is actually generating revenue and repeated sales. The quality of the Felix system, you should know, has attracted a leading global IVF partner to help us access commercial markets through sales and legitimise the use of Felix in the IVF setting, whilst building end-user certitude through key opinion leader networks. Now, when launching a product that's new into the market, all of these things are extremely important. From a management and scientific perspective, our company is definitely underpinned by a highly credentialed and motivated, innovative team. The team consists of a motivated, new executive management team, a board who are also highly motivated and focused on commercialization. And I think these are the perfect ingredients to lead us towards a good commercialization strategy. Next slide, please. You'll meet him later, but I would like to speak a little bit about Professor John Aitken. He is our scientific director. You should know that he is actually one of the world's leading experts in reproductive technology and biology, and these people aren't easy to come by. John actually leads the development of MEM's pipeline of products through R&D and proof of concept. Our commercial and research goals are to identify areas of unmet need, thus being rest assured of a definite and definitive commercial pathway and a defined market. Now, this is the best way to develop a product or a drug into market, is to define the unmet need and to solve the problem, and thereby you generate a product which has the ability to definitely be sold in the market as the users will want to use it. Now, John is our unmet need problem solver here at MEM. He solves many problems for us around the many products that we have in our pipeline. He's an exceptionally well-connected key opinion leader at a global level. And again, these aren't hard to find. These are very, very hard to find. He has numerous global connections with key opinion leaders and centres of reproductive excellence throughout the world. And shortly you'll hear from John, and I'm pleased that he will be telling you about our Rockstar product. Next slide, please. In addition to John, we have a highly credentialed board and key management team who have combined more than a century of experience in the commercial delivery of innovative products. Slide. Now let us look more specifically at our most advanced product that you can see in a moment, the Felix system, which is already generating commercial sales in low regulatory markets. Slide. But I think before I actually show you more about Felix and tell you more about it, it's necessary to understand the unmet need, because I've spoken to unmet need previously. And the need that the Felix device fills actually solves a series of underlying issues that are actually in the IVF space. And these are as follows. Global fertility is actually decreasing. Not many people know this, but it's a fact. Both the governments of India and China have actually had mandates from the government to increase their population because they're having issues with fertility in those countries. You should know that males actually account for approximately 50% of fertility issues, and whereas previously it was always thought that it was the females. And it's more important to consider that sperm dysfunction in males is the most common cause of male infertility. We should also note that over the past 40 years, there has been little or no progress in sperm processing technology, which again leaves a good opportunity for Felix. You should know that sperm counts have been decreasing and that DNA damage and oxidative stress are major contributors to this. Thus, solutions to identify and reduce DNA damage and the effect of oxidative stress are desperately needed. And that's where the Felix device comes in. It solves these unmet needs. Slide, please. Here you can see the Felix device, and the Felix device is an easy to use and efficient system that employs electrophoresis to select sperm with both low DNA damage and reduced oxidative stress. It solves two problems. The Felix system itself consists of a low footprint console. Now, this is perfect because generally speaking, most laboratories are extremely crowded, and you could probably fit up to 5 or 6 or 9 Felix consoles in the space of the equipment that's currently used for sperm processing. It uses disposable single-use cartridges, and this is the kicker, because revenue is generated from ongoing use and sales and replacement of these cartridges since they are single-use. The business model is similar to that applied by printer manufacturers, where you simply buy a cheap printer, but then you constantly need to purchase new ink cartridges, which is where the money is generated from. Current experience has demonstrated that once the system is in place in an IVF centre, we've seen that cartridge consumption has increased and the use of the Felix system has grown. Slide, please. So why is the Felix system so compelling? Of all of its attributes, there are 3 that stand out to me. Number 1, that it's fast, it's easy to use, and selects sperm with reduced DNA damage. You should know that as we're involved in meeting unmet needs, that these attributes are directly aligned with the industry's unmet needs in sperm selection and clinical utility. You should also know that even though I'm from MEM, that MEM aren't the only people that are saying that. And in fact, major IVF centres and distributors have also indicated that the processing speed of the Felix system has actually revolutionised their IVF operations and created great efficiencies. From the academic community, the key opinion leaders globally who have used the system have published many papers which confirm that Felix not only has these attributes, but also has shown superior results compared to the current conventional methods of sperm selection. In addition, both across India and Japan, we have already received numerous reports of babies being born from parents who have used the Felix device and who have had multiple IVF failures. Within the groups of these parents that have failed to have children, many of the males' sperm has been so bad that the males would have normally had to have resorted to having testicular biopsy. Yet the Felix device has been able to provide them with sperm and select sperm and provide that sperm for IVF to allow these couples to have children. I should also mention that the Felix device is also yielding the best embryos for development, and this has been reflected by the amount of clinical utilisation for the embryos that have come from sperm from the Felix device. Thus, the Felix device, we believe, as others do, both key opinion leaders and distributors and the IVF industry, believe that the Felix device is actually well positioned against the current processes, making it a must to have in an IVF laboratory. Slide, please. What is clear is that we have actually developed a world-class system for selecting sperm and that the market opportunity is massive. Initially, we were focusing our efforts on rolling out the Felix system to early access, low-reg markets, such as Japan, Canada, and New Zealand. These markets are growing steadily or beginning to adopt. While some of you may have hoped that these sales would increase quickly, it is important to note that we have taken a considered approach whilst rolling out the Felix system. And I have to say that this is actually a standard medical industry practice that is used across both the pharmaceutical industry and the device industry. The reason for consideration is that by nature, IVF centres are conservative, and given the work that they do not want to make sudden changes to their practices and procedures. This is a standard medical industry dogma. It is important to share with you that the new products that are released to market must actually be legitimised in terms of their usage, and that we must build end user certitude. And this is done by allowing IVF clinics, physicians, clinicians to actually use the product and to gain confidence that it actually works before they apply it to their routine daily practice. Therefore, we must be considered and patient while we build customer trust and a solid customer base. And this will actually end up giving us return sales from the marketplace. And only when we can be confident that the uptake, only then can we be confident that this uptake of the device will occur and repeated sales will increase. We already have a strong distribution partner for these markets, Vitrolife, who we've previously spoken about and who some of you may be aware of, and we expect to continue to see sales increase. We've already achieved success in some of these early access markets, all of which has actually put us in good stead. And I think it's important to note that the ability to enter early access markets isn't afforded to every device in every industry. So we've actually been quite lucky to be able to use the device in these low regulatory territories and then actually build end user certitude and legitimize the use of the device, because this will actually stand us in good stead when we decide to enter the larger regulatory markets such as Australia, US, China, India, and the EU. Slide, please. I mentioned previously our distribution agreement with Vitrolife in Japan. However, I think that I really should put some context around who Vitrolife are and why they are the perfect synergistic partner for a company like us. There are many matches. They are one of the world's largest providers of medical devices, consumables, and genetic testing services, and they are actually dedicated to the human IVF and reproductive health market, which I think is very, very important for a premium device like ours. Globally, Vitrolife employs over 1,000 staff across 33 countries and has products and services available in over 125 countries globally. In Japan, they have direct commercial engagement with about 90% of all IVF clinics in that market, and hence they are the perfect partner to grow our commercial operations in Japan and globally. They have a deep local understanding of the Japanese market and the global market, clinicians' needs, proven relationships, and a deep desire to innovate in the area of human IVF. Moreover, and I think this is a big tick for MEM with the Felix device, is that Vitrolife only sell prime high-value products in their product range, which puts us at the top. Vitrolife, I have to say, have been extremely valuable in assisting us with the commercial rollout of Felix in Japan, and now Vitrolife and Memphasys have an expanded distribution agreement to enter into Canada and New Zealand, where we are starting to slowly get adoption and have further discussions. Slide, please. Now, I would like to draw your attention to our latest announcement regarding the Felix trial, where we have achieved remarkable success and progress this year. And I'm extremely proud of this as the manager of this company and the staff that I have behind me who have helped facilitate the progress of this trial as well. Importantly, you have to recognise, and you will see that this trial has now reached a significant milestone of 90% completion. And I think that's a huge, huge effort from the company with only who began this series of contingencies early in January this year. So we're now at 90%, and this definitely reflects our management team's efforts to fast track this trial, which is what I wanted to actually do from the go-get when I obtained this position. And now we're 90% when we were originally less than 50% in January this year. And I think that that's a huge achievement. I should also say that as of today, several new patients have already consented and are awaiting treatment. And I think that this aligns trial completion with the calendar year, the end of this calendar year, of course, subject to final recruitment. And I have to say that the actual numbers that we recruit is something that we can't control, nor is the number of eggs that are provided by each of the females in this study. However, we have done and are doing everything to ensure that we get as many patients possible to actually complete by the end of this year. These trial outcomes, I believe, will provide the essential data for use in our regulatory submissions, and this is crucial to the launching of the system in key regulated markets. Without this, we have nothing. Positive trial outcomes, which we expect from the study, will also accelerate discussions with potential distributors, perhaps other than Vitrolife, strategic partners who may want to buy the Felix device, and investors, and provide various opportunities to actually expand the commercial reach and secure investment for broader growth of the company. So I think we're well positioned at the moment with our commercialization strategy to ensure ongoing return on investment in coming years. Slide, please. Now, I know that some of you have been following this story for quite some time and that some of the information I'm about to give you, you may have already heard, but I'm actually providing this for context. I think it's important to celebrate what we've achieved to date. In 2023, we had initial sales from the prestigious Kobe Clinic in Japan. Now, this is one of the largest clinics in the Japanese territory, and they are still continuing to order because they believe in the Felix device. In May 24, we had positive trials from Japan, where a clinical trial actually showed that the Felix device outperformed a combination of both DGC, density gradient centrifugation, and swim up. And you should note that Felix outperforming a combination of both these processes is quite a big tick for the Felix device, where normally we would just compare it against one of the single processes at a time. And this study was published and presented at ESHRE in 2024. We've been promoting the collection of data to support the incorporation of Felix in the private health sector in Japan. And you should know that currently the addressable market for Felix in Japan in the public sector is only 20% of the total market. And as currently, there is no Japanese insurance reimbursement strategy for Felix or category for Felix in Japan. However, Vitrolife and MEM are working to build this clinical data set, which will allow us to access clinics in the Japanese national insurance system. And therefore, by doing this, we will be able to expand sales into the 80% remaining of the Japanese market. Finally, we are incorporating a Japanese clinic into the registration study. Again, this proves the Japanese commitment to the Felix device. And Vitrolife are actually involved in this process as well. Thus, this is expected to be completed by the end of 2024, that is this year, with the addition of this clinical trial in Japan. Slide, please. In India, many of you may know that we saw high interest and an excellent uptake with initial sales of Felix and follow-up orders for Felix. And indeed, initially we've had up to 11 live births, as I've spoken before, from patients who are very challenged at having children and who had had multiple failed IVF cycles. However, in 2022, unfortunately, and much to our disappointment, as well as the clinics in India, sales of Felix were suspended because the regulations in India changed. And all of a sudden, they went from a low regulatory market to a high regulatory market in terms of the Felix device. However, that hasn't daunted us. Ever since that time, we have continued to explore ways of getting back into India. And MEM is now currently seeking regulatory advice on how we can possibly import Felix for paid testing until full country registration is possible and achievable after our CE mark registration. Slide, please. Now, this is another exciting area which I'm very, very excited about, and there's a considerable number of commercial and return on investment opportunities from the equine market. Now, this is a highly lucrative sector in which we are now currently positioning the Felix device to be a leading technology for equine sperm separation. The global equine artificial insemination market is estimated to be valued at $681 million US, and is projected to grow at a compound annual growth rate of 5.7 between 2024 and 2032. Currently, we're involved in a 3-year equine fertility study in conjunction with the University of Newcastle and a global leader in equine reproduction, Equibreed UK. Importantly, and I think this is very important to note, is that we've already received highly positive results from an initial study which evaluated Felix's commercial potential in improving the quality of frozen thawed stallion sperm, and hence we have now moved into this larger study. Now, I believe, and the team here believes, that this is a huge commercial and lucrative leap forward for the application of Felix as a device that can be used as is, with no modification, off the shelf. We are able to actually enter this market into non-thoroughbred equine breeding sector without actually making any modifications to the device or spending anything extra on development. And I think that that's a huge cost saving. And we will continue to look at other applications for Felix across other markets where we can employ the device without having to do any further R&D. This ongoing study that we're participating in is expected to generate the necessary data and gold standard data, similar to what we see with the Felix trial, which is necessary for entry into the market, and we should be able to provide sales within around 12 months. We're currently looking for a global distributor and partners to help take the device into those markets. And as I know from current market research, there are approximately 4,000 equine semen processing facilities worldwide, which gives us a huge opportunity to market this device across the world. You should also know that we've been very smart, because this trial is actually only costing us $30,000 a year over 3 years, and $30,000 each year. And the cost of that is actually partially offset by R&D tax credits. But all in all, we're actually leveraging about $1 million of research value. So it's extreme value for the company all around, hence the decision to proceed in this direction. Slide, please. This slide outlines the regulatory path associated with accessing the more highly regulated markets. In our most recent ASX announcement, we highlighted an updated regulatory strategy for Felix post-clinical trial completion, with the company now prioritising CE mark registration in Europe over TGA in Australia. And I'll highlight some reasons why we've actually made that strategic change. Importantly, CE mark offers a faster and more lucrative pathway than the TGA registration. Our current regulatory advice suggests that with the CE mark process, it could take less than a year. And I believe that if we were prepared to pay an extra fee, that we may even be able to expedite that and reduce that time frame. Now, when you compare this to the TGA, which is currently predicted at 18 months, and we found that now it is 18 months because of the regulatory backlog of the number of submissions that are going into the TGA, that would take at least 18 months by the time we submitted before we actually got regulatory approval in Australia. But it's not only the timeline that's important, it's also the fact that the CE mark registration will actually allow us to enter key markets earlier than anticipated, which I think is important, because it's all about the time frame that we use, and we're trying to expedite everything we can from the clinical trial completion through to our regulatory process to get return on investment for Felix in lucrative commercial markets where we can see commercial growth and return on investment. Regardless of our exact trial completion date, whether that tips over into early January, where we may need a few additional patients because we cannot control recruitment or the number of eggs that are given to the study. We expect that this process will still bring us in better time frame than the TGA registration process that was originally proposed. And having said that, we're already on the horse, and we're currently completing our technical file for regulatory submission to be submitted second half of 2025. Meanwhile, I believe that we've achieved remarkable process this year in the Felix clinical trial, which provides the essential data to be used for regulatory submissions. And these are crucial for launching the system into key regulatory markets. The Felix trial is now 90% of completion. And you should know that we only require fewer than 20 patients remaining to complete the study. And our current trial trajectory is saying that we will be completed by the end of the year, pending no issues with recruitment, to bring the trial to the close by the end of calendar year. And we're very, very happy and excited with our progress. And we are looking forward to closing the trial off. And I think that this milestone, should we achieve it, really reflects the current Memphasys executive team's efforts to fast track the trial from less than 50% at the beginning of January this year to now 90%. In terms of TGA registration, MEM will still have the ability to register for TGA shortly after CE mark registration, and the registration with the TGA following that CE mark registration, I believe, will be essentially an administrative process. And once we have in-country registration with the TGA and CE mark, we should be able to enter the Indian market very, very quickly. And you should note that also that there are a number of smaller countries who are involved in IVF with reasonable markets, who we can then enter as well, because they will accept both TGA, CE mark registration and certification, and allow us to market in those countries as well. Slide, please. As you can see from this slide, there have been a number of merger and acquisition transitions in the IVF space. And with further commercial success, and on the back of the clinical trial findings, to conclusively demonstrate the benefits of Felix, I believe, and we believe as a company, that Felix is actually now well positioned for potential M&A activity. And this might mean that a partner comes in and either buys the device or helps us do further development. And we're now looking at possible avenues for moving that forward. Slide 19, please. So it's not only us, but I just wanted to demonstrate to you quickly that the Felix device does actually work. And we've produced a significant number of independent publications. And it's important that these are actually independent and nothing to do with MEM. And these have been published in peer-reviewed journals and support the fact and highlights the benefits that Felix has over traditional sperm separation techniques. Slide, please. Now, for your edification here, this slide shows the timelines for the development of the Felix from a regulatory perspective. And note that the clinical trials are already significantly advanced here now in October with 90% completion. And we expect to complete pending recruitment by the end of 2024 this year. And once the trials are completed, MEM will definitely then move into applying for CE mark registration, and we're already preparing our regulatory dossier for that. So there will be no time wasted. As mentioned previously, we have strategically prioritized CE mark registration over the TGA, as we believe it will take a shorter time to registration with potential expedited pathways in lucrative commercial markets, see entry into multiple significant larger markets, and provide greater sales registration and a significant return on investment. After we obtain CE mark registration, we will have the ability to register the system, as I've said before, in Australia with the TGA. Furthermore, this slide shows a timeline to expand proposed activities in India. Now, I see India as already waiting market. We still have Indian clinicians writing to us to say when can they possibly get access to the device. So I believe that once we have achieved some of our achieved a completed clinical trial, as well as our CE mark registration, that we will have a ready waiting market for us in India. And I believe that this will be extremely lucrative because we've already proven our worth there. And finally, the slide also shows our proposed expansion into other global markets. Now I'll hand you over to my esteemed colleague, Professor John Aitken, who will take you through the Rockstar device and many of its interesting facets. Thank you very much.
Well, thank you very much indeed, David. And the unmet need that we're going to be addressing in the second part of this presentation is the need to address oxidative stress. And in the next slide, I'll just very briefly describe what we mean by oxidative stress. So oxygen is a very strange molecule. On the one hand, all aerobic life forms depend upon it. Without oxygen, they can't survive. But on the other hand, it can be quite a dangerous molecule. And some interesting examples of that would be the rusting of iron when it's exposed to air. Or if you just take an apple and cut it in half and leave it exposed to oxygen in the air, you see that it will suddenly go brown because key components of the tissue of the apple are becoming oxidized. So oxidative stress is essentially a process whereby oxygen attacks key molecules that are essential for life. The next slide, please. A key concept in this area is one of redox balance. So every cell in your body is generating these toxic oxygen metabolites, reactive oxygen species, every second of every day. But it's okay, they don't harm you because your body is replete with antioxidants that counter their effect. And 99% of all of the reactive oxygen species are actually scavenged by your antioxidant system. So it exists in a state of balance. However, you can come across situations where the balance is tilted in the favor of the oxidant rather than the antioxidant. That happens when we age. We are all oxidizing a bit too fast. It happens when you're exposed to environmental toxicants. It happens when you're exposed to unhealthy lifestyle factors such as obesity or cigarette smoking. When that happens, the generation of these reactive oxygen species outweighs the ability of the antioxidants to counteract them, and a state of oxidative stress is arrived at. So the natural inclination when that happens is for people to take antioxidants, and they do so on the basis of it might do me some good, can't do me any harm. But actually that's not true. If you overdose on antioxidants, you just tilt the redox balance in the other direction and you go from oxidative stress to reductive stress. And that can be just as harmful as its oxidative counterpart. So next slide, please. So what Memphasys has done is develop a device that will enable you to monitor your state of oxidative stress. It will tell you when you need to take antioxidants, and it will also tell you when redox balance has been achieved and you can stop taking those nutritional supplements, because if you keep on taking them, they'll do you more harm than good. So this is a way of basically helping to regulate your antioxidant intake. And that's a critical thing. A large percentage of the population is now taking antioxidants, and it's a market worth over $4 billion a year. Next slide, please. So what have we done? Well, one of the things we have done is to develop an entirely new system for measuring antioxidant activity in biological fluids. The assay itself only takes 6 minutes. This is completely different from the laboratory procedures that are currently used, which can take hours, if not days. We can do it in 6 minutes. We have developed prototype devices. We have engaged with KOLs, a variety of KOLs in different fields, and I'll tell you about those fields in a second. We have built a prototype device, which is being used for these studies. And we have basically engaged with industry to establish baseline values for antioxidant activity and just see how well it operates in the field. And as David has already said, we're engaged in a long-term collaboration with Equibreed UK. And one of the things that we're exploring in that collaboration is the value of this device, which we call the Rockstar device, to monitor oxidative stress in the equine breeding industry. We have filed a patent covering our invention in this area, and we have trademarked the name Rockstar to cover this particular development. And we've engaged proactively with industry, as I'll describe. Next slide, please. So this, in essence, is what the device looks like. Essentially, we do in 6 minutes what it can take hours in conventional laboratory conditions to achieve by using an electrochemical cell. We electrochemically oxidize a probe, and this is then used to measure antioxidant activity. We have worked with an industrial design company, DNI, who have done a fantastic job in developing a cartridge within which this chemistry can operate. And we have now developed a workstation design, which we are using in current studies. And this is the first step, really, before we develop the fully developed and automated system. And the beauty of the fully automated system is that it will be a point-of-care assay. We will take oxidative stress measurements out of the laboratory and put them in people's hands so that they can be used in the breeding sheds or in the clinic, or even, I think, ultimately by individuals themselves to monitor their own antioxidant status. So we've gone a long way to developing prototype devices that are now being used in proof of concept trials. Next slide, please. So what's the advantage of our Rockstar system? As I've already indicated, people have been making antioxidant measurements in biological fluids for decades. But to do it, they have required complex laboratory equipment. The assays themselves take hours and sometimes days to achieve. Very often, because of the complexity, oxidative stress just goes undiagnosed. Clinicians don't bother to look for it. And because they're not diagnosing it, there is no clinical intervention appropriate to resolving the oxidative stress. What Rockstar does is turn this whole chemistry into a point-of-care diagnostic device. It can be used right there in the presence of the patient or in the presence of the animal in animal breeding situations. It's a very, very rapid process. Just takes 6 minutes to get a measurement. It's sensitive and accurate, and we've already published one paper now describing just how sensitive and accurate it is, and we have another paper in press describing that. This paper also covers the application of the Rockstar device across a wide range of fluids. So we have proven its efficacy in measuring antioxidant activity in semen, in blood, in urine, saliva, follicular fluid, spent embryo culture media, foodstuffs. We've done a survey of fruit juices, for example, with this device, measuring antioxidant activity in fruit juices. And we've even looked at cosmetics, because very often cosmetics are supplemented with antioxidants to preserve skin quality. And we have done a survey of commercially available cosmetics to see just how much antioxidant they contain. It enables us to achieve much more accurate disease profiling. And because you can do it at the point of care, ensures that you get timely clinical interventions. Next slide, please. So what are the various applications for the Rockstar device? Well, first and foremost, we have been working with the IVF industry because, as David has already mentioned, oxidative stress is a key cause of both male and female infertility. So we're using the Rockstar device to screen both male and female patients in an IVF setting. I'm also collaborating with endocrinologists and obstetricians who are using the Rockstar device to monitor the progress of pregnancy. because it turns out that many complications of pregnancy, such as preeclampsia or one of the most devastating of all, fetal death in utero, are predicated on a state of oxidative stress. So if we can measure oxidative stress in our pregnant patients, get an early indication of when the fetal placental unit is in distress, this should enable us to intervene in a timely manner to preserve the normality of pregnancy. We've worked with the food industry. The food industry is very keen to know about antioxidant activity. On the one hand, they're keen to develop plants, produce plants, materials that are rich in antioxidants. On the other hand, they want to know how much food processing damages the antioxidant activity in food materials. So we're collaborating with food technologists in the university in order to explore the application of Rockstar in that context. We're also working internally, using the MEM device, the Rockstar device, to identify new and improved antioxidants that could be incorporated into, for example, animal and human media for in vitro fertilization and embryo culture. We're working with other clinical groups because oxidative stress is not just involved in the etiology of infertility. It's actually involved in the etiology of many, many important diseases, not least of which is cardiovascular disease, the major killer in our country, and neurological disease, things like Alzheimer's, which have a great prevalence in our own society, are based on oxidative stress. So these measurements should be of value in clinical scenarios outside of the field of infertility. Ultimately, we hope that this device will be developed to the point that it could become a point-of-care device that could be used at home. It's to do with the democratization of diagnostics, that people will take their diagnoses into their own hands, buy their own devices, do their own monitoring. I do that now with my blood pressure. And you could do it for your antioxidant activity and use it to determine when you should take and when you should cease taking antioxidant supplements. And so it will be an important part of personalized medicine. We will, as I shall describe in a few slides' time, be developing close collaborations with the animal market, both livestock, so in particular horses and cattle, but we are also potentially interested in domestic pet markets as well. And then finally, as I've already mentioned, we have had a brief foray into the cosmetics industry because we think that cosmetic industry itself would also be very interested in a rapid and efficient means of monitoring antioxidant activity in its products. Next slide, please. So just to get into the animal side then a bit, so oxidative stress is very important in the cattle industry, and it's important for a number of reasons. First of all, a resistance to oxidative stress is a genetic characteristic that you want to breed into your livestock. And that's because oxidative stress is a key response to heat stress. And as we go through climate change, it would be very important that we are breeding cattle to withstand the stress that's going to arise from rising global temperatures. So monitoring the antioxidant status of different breeds of cattle is going to be important, and breeding for that resilience will be important. It's also important for genetic markers and the true breeding of traits. We go through a lot of trouble to select animals that have particular genetic constitutions. If your animal is under oxidative stress, one of the consequences of that is you get high levels of DNA damage in the germline, particularly the male germline, and the result of that is that the mutation frequency in the animal's offspring increases dramatically. And where you start to have an increase in mutation frequency, you lose your capacity to truly breed traits. You've selected for important genes only to find that those genes become mutated because you haven't controlled oxidative stress in your animal. So this is a a very important area for the animal breeding community, both in cattle and in horses. And with both of these programs, we have good commercial applications. We've already mentioned Equibreed as our major collaborator in the horse industry, and we're collaborating with Clean Gene, Pty, and Michael Cameron and his colleagues for studies in the cattle industry. Next slide, please. And this just takes us a bit into a bit more detail in the cattle industry study. We are now commencing a study. It will commence next month. It will be quite a large scale study on dairy herds. Over 400 cattle will be monitored in this program. We'll be monitoring male and female cattle as they go through the rather stressful process of mating, initiating pregnancy, and lactation. And we will, in the course of this study, also be looking at the value of supplementing the animals with antioxidants to see if that can help optimize their breeding performance. So that study is already designed and developed. We have optimized our procedures now for working with cattle material, so we can do actually quite rapid, high throughput screens with these blood samples. There will, in the end, be several thousand blood samples to analyze in this particular study. And it will help, I think, define the importance of Rockstar in the animal breeding industry, and thereby enable us to develop further partnerships with players in this particular industry. Could I have the next slide, please? So that really completes what I was going to say about Rockstar. Later on, I'd be very happy to answer any questions about this really innovative new system for very rapidly and effectively monitoring the antioxidant status of humans and animals. Over to you, David.
Great, thanks, John. A very interesting presentation. I will now continue to talk about other animal applications, specifically AI port. Now, I know many of you are familiar with AI port, and in the past have seen some reports from MEM around the product. But I'd just like to reiterate a few points because the system is actually very valuable. So what is AI port? It's an extended way of transporting sperm in a medium that works without freezing sperm. And by doing this, we actually limit the amount of DNA damage and oxidative stress within that sperm sample. It actually maintains a viability of livestock semen for up to 7 days at a temperature range of around 22 to 25 degrees, which we term ambient. So the sperm can actually be stored in that medium and transported in that medium for up to 7 days, which is a significant breakthrough. It enables the collection and transportation of semen without needing cryopreservation. And I think that if there's anybody here on the call that is familiar with the cryopreservation of animal sperm, when you actually receive your straws, you're actually getting a 50% yield of the 100% that you actually thought that you were getting. And I think that that has a significant impact, especially when you have very expensive and genetically valuable strains of genetic material that you want to preserve and try and use as much of it as you can, especially if it's in limited supply. So our system actually provides a greater number of viable sperm compared to cryopreservation to the end user, which I think is a significant breakthrough. And to give a commercial context to AI port, the estimated beef, that is non-dairy market, is around 2.4 billion Australian. So again, it's quite a significant market. Now, we've done some previous work on that, AI port, and we're currently refining the system. And we're well on our way to refining that system and having the system in place to test next year in further clinical trials. And we'll look at our current in vitro results and make determination as to how we should best conduct those trials next year. Slide, please. Okay, now I'll finish up with a quick financial snapshot of our business. Slide, please. I'd just like to say that we have a significant group of major shareholders who have backed the company over many years and participated in all, if not most of, the capital raisings during that time. And I have to say, even though I've been with the company for a short time, I truly appreciate the dedication and support from all those investors, as it's allowing us to continue to operate, and hopefully will allow us to continue to operate so that we have a definitive runway to commercialization. Some of the people that need to be thanked are Alison Coutts, the former CEO of the organisation, and Andrew Goodall, who have been significant contributors. A third major contributor, of course, is Bob Peters from Peters Investments, and we currently have a convertible note with Peters Investments, and this has been rolled over several times, and we continue to work closely with Bob and Peters Investments in keeping them abreast of our corporate strategy. You might have seen that recently we announced a $2 million capital raise to expedite commercialisation activities, and essentially that consisted of a $1 million strongly supported by existing shareholders, sophisticated and professional investors, and we've also introduced a share purchase plan to eligible shareholders to raise an additional $1 million, giving us the $2 million that we require. These proceeds, as the shareholders you should know, will be applied to, number one, the finalisation of the Felix trial and the regulatory process for the Felix trial to get it into market and commercialise the product. Secondly, we are going to use the funds to progress the equine fertility study in both Felix and, as John has mentioned, also looking at the impact of oxidative stress through Rockstar in the equine study, which again will give us another market in the equine market for Rockstar. And we're always looking broad and wide to see where we can apply our products. And it will also allow us to conduct a study which is really set to, and as John has mentioned this, is set to establish a baseline and thresholds for oxidative stress that's likely to be associated with reproductive performance. And as John has already mentioned, we're about to commence that study. In addition, we recently attained a $500,000 short-term loan facility, which was there to provide essential working capital and allow us to continue. Slide, please. As you can see, and to close the presentation, and as you can see and heard, we have brought into the company new talent that focuses on commercial outcomes, and this is extremely important. We've opened up new markets and are generating sales in those markets. We know the products that we are developing meet an unmet need and that people want to use them. And we have a pipeline of products that have a clear commercial focus and outcomes. And these are being developed with the support and encouragement by industry participants who have a very clear view and focus on commercial opportunities. Now, I'd like to thank you all for participating, and I hope that you found this webinar enjoyable and informative. And that brings us to the close of this session. But I'd now like to hand over to David Tasker, where he will be fielding questions from the attendees, and we will try to best answer these questions as we move forward. Thank you. Thank you, David.
Thanks, David, and thanks, John. A great presentation, very thorough, which I think is definitely what the shareholders need to better understand the amount of work and the milestones that have been hit by Memphasys in recent times. Question for you, David. There is a stack of questions, so we're just going to get through as many as we can. When you came into the role, what was the focus, and are you happy with what has been achieved?
That's a fantastic question, David. I think it allows us to blow our trumpet a little bit, but I think that the first thing I believe that we did as a team here, and I will say that I'm not entirely responsible, and I give credit to the team that I work with, who are fabulous, is that we moved forward initially to reduce our operation expenditure. And we believe that that was important to enable us to revert that expenditure to commercialisation activities, which would bring in return on investment for our shareholders. And I think that that was something that we needed to desperately do. I think another thing that we did was to put in contingencies that, by the way, I have to say, and as you've probably seen, are paying off to fast track the Felix trial. to 90% completion now. I think another really important focus is that myself and the team have looked at regulatory strategies, and we all know that time to market is important, and making hay while the sun shines and getting our products there is extremely important. So revising the regulatory strategies in a way that would give us the fastest route to commercial opportunities, but also open up as many commercial opportunities as possible. And I think that we're well on the way to achieving that as well. I think that importantly, we've looked broader at the product range that we have, and that includes both Felix and Rockstar. And we've tried to establish other applications outside the human area that would bring a return on investment and commercial opportunities for the organisation. And I speak specifically to Felix in equine, and I also speak to Rockstar in equine, and I also speak to bovine in Rockstar as well. So I think we're looking and we're opening up as many possibilities as possible where we don't have to put any more developmental money into these products to essentially create streams of revenue. And I have to say that I'm continually excited, and every day that I'm happy with our progress to date. And I think that we're on a very exciting adventure, and I'm very pleased and excited to share this with our investors and shareholders.
Question here in regards to Vitrolife. Clearly a significant business in the IVF space globally, and as you touched on, are very picky when it comes to who they deal with and the type of products they align themselves to. There's a question here from a shareholder talking about the delay, I suppose, in them ramping up sales. Did you think sales would come quicker once Vitrolife was signed on? And do you now understand the importance of the Felix clinical trial to ramping up those sales?
Yeah, look, I think that any business has to put in place risk mitigation strategies, and I think that that's a sensible business process. I think Vitrolife, I'm very pleased to be associated with them, and they only buy premium products, and they saw Felix as a premium product, so we have that association. But there's always a caveat, and as I've alluded to before, it takes a while to open up markets and build legitimacy for a product and user certitude. So Vitrolife have been helping us with that process, which has been marvelous. We've been given a great opportunity to work with them. I think that in terms of sales and how much they're willing to push that at this point, really, I think the risk mitigation strategy that is being employed, having spoken to them, is really that they would like to see the final clinical trial results, because in any business like this, and we all know that many drugs go to market and go to phase 3, and seeing those final conclusive results is vital to how much money you want to put in as a potential partner taking on a product and moving it through the market. So I think that they've got a little bit of a risk mitigation plan there, and they're going as fast as they're able to, and I appreciate that. And I think that we should all be cognizant of the fact that they're helping us a great deal, and that that relationship is extremely important. And we hope that once we get our data, and we have no reason to doubt that it will be anything but positive, that they will then move to either acquire the device or to go into a global distribution partnership with us, and then actively and aggressively sell in the markets.
John, just on that, so the clinical trial clearly is very important. Do you expect it to expedite commercial outcomes once the findings are known, even before the published papers are out? Do you think the clinical trial will be a key catalyst for the expansion of commercial opportunities for Felix?
That question was to me, David?
Sorry, it was. Yes, John.
Yeah. So I think, as David has already alluded, we think the clinical trial is critical for building confidence within the industry, that this is a revolutionary new way of isolating spermatozoa, which hasn't seen a change in technology really since the beginnings of the IVF industry. We have collaborated with a lot of different people now, lots of different groups. They've all, I think universally, those groups that use the Felix device are happy with it. And once we get that clinical approval, I think you will see a ramping up of the take-up of the technology and therefore the profitability of our contribution to it.
And David, you have referred with a number of recent announcements and even today's presentation to strategic discussions. Are you starting to see inbound inquiries, particularly as the trial's nearing completion, a lot of papers being published, not just for Felix, but there's a lot of work, as you said, being done in the other projects and products that are being developed. Are inbound inquiries coming, and do you think they're an opportunity to advance the range of products in a less dilutionary way for shareholders?
Yeah, look, I think to be honest, David, we and without blowing our trumpet again, you know, I have to be honest and very transparent here, is that we actually receive a plethora of communications almost on a weekly basis from potential distributors, and there's people who are at a higher level, you know, interested in working with us to either further development or to work out how they can get our product entry, you know, into their markets. And I think that to me is extremely encouraging as someone managing this organisation, because I can see that, you know, given the point that we actually get full registration, that the product will definitely be, you know, snapped up or distributed, you know, globally by somebody. So I have no doubts that that won't happen. I think we're in a very good position.
And there's a question here in regards to the clinical trial itself. Obviously looking to complete at the end of the current calendar year or subject to recruitment early in January. We all know there's a process to get peer review papers out and the like, which can take some time. But when do you think the results, potentially in an executive summary style or similar, will be released to the ASX?
David, I think that when we get the definitive preliminary statistical analysis done, which will be probably about a month after the close of the trial, because when we close the trial, we just can't do the analysis straight away. There has to be what we call a data cleaning, and that will have to happen, and then we will have to do the analysis of the primary endpoints. And I think that, to be honest, once we get a positive readout, David, I'll be standing on the top of my building here, shouting it to the ether that we've met our endpoints. And I think that at that point we will be able to announce, as other device and pharmaceutical companies do, that we've had positive endpoints and completion of positive endpoints. So that should probably take about a month to 6 weeks after we finish. Having said that, we will immediately move into preparing publications, and the publication will probably be embargoed for a short period until it actually comes out in the publication. So we won't be able to say too much, but I think that the shareholders should know and will know as soon as that endpoint is available.
And in terms of the regulatory path through the EU, what does that mean for India? Does it slow it up, speed it down, or does India just wait a little while until further regulatory paths are met?
Yep. So we've thought long and hard about this, David, and to be honest, as far as I'm concerned, we have a ready waiting market in India. We have customers who want to use the device today, but they can't because it was removed from the market due to regulatory changes. I think that CE mark is the way to go. Once we do CE mark, Australia will be pretty much as I'm told by our consultants, almost an administrative tick, and it will take a little time. Again, nothing happens overnight. It's just not a straight tick, but it will happen very quickly compared to other processes. CE mark gives us a great market. Australia will be a market, and once we have in-country registration in Australia, I believe that the Indian regulatory authorities through the CDSCO will then accept a lot of the data that we've actually produced. So I believe that getting into India will be very quick as well. So there won't be any delays, but we're going to do it in a stepwise fashion to ensure that we cover all our bases and get our major markets. And I think that The other thing too we need to look at as a company is that the number of requests we get from China, who are absolutely enormous in terms of their IVF requirements. I think that that's another area that we will be actively looking at in our regulatory plan as soon as we get CE mark approved.
And John, a couple of questions here on Rockstar, so I may turn my questioning to you if that's okay. For Rockstar, what sets this product apart from other assays of oxidative stress that have been around for some time?
Yes, thanks for that question, David. I think the technology is revolutionary just because of the speed with which we can do the analysis and the potential it has for developing point-of-care measurements. So, as I already indicated in my presentation, conventional assays of antioxidant activity require laboratories, sophisticated laboratory equipment, and they take time, they take hours to do. Our assay can be done in 5 minutes. And we have 2 different versions of the assay. One we've adapted for high throughput screening. So when we're dealing with cattle industry, for example, and have literally thousands of samples to analyze, we can do that very quickly and easily. And but for the high value markets like human and horse, we're developing point of care assays where it's not done in a laboratory, actually done in the breeding sheds and in the clinic. And it enables clinicians then to respond very rapidly to any changes in antioxidant activity in the patient or the horse, and provide them with the appropriate supplementation. So it is essentially the speed with which the analysis can be done and its potential for being a point of care determination.
And just looking at application and opportunities of that technology, how wide is the potential application use?
Well, oxidative stress is important for every biological process. So as I already indicated, plant breeders will be very interested in monitoring antioxidant stress because they're trying to generate foods that are enriched in antioxidants. Food technologists are interested because they want to know how to best preserve those antioxidants as they process the food. A whole variety of different areas of clinical medicine, from neurology through to reproductive health, are interested in making these kind of measurements. The cosmetics industry is interested in making these measurements. Essentially, I think the number of potential users of this technology is enormous. And what we have to do is engage with each of those industries in turn and basically refine the instrumentation, the design of the device to meet their specific needs.
Yeah.
And what about a very specific question? So I assume the person who asked it is heavily involved in the agricultural sector. Commercial cropping, is that an opportunity?
Absolutely, it is. So in the crop industry, again, breeding plants that have high levels of antioxidant activity breeds in resilience to stress. And there is going to be stress to crops in the future because of temperature changes, because of water shortages. All of these things are going to impact the efficiency of the crop industry. And being able to monitor the antioxidant levels in your crops and breed for high levels of, select for high levels of antioxidant resistance is important.
And a question here in regards to timeframes for Rockstar to be used in research labs. Do you have a time frame that the company's working for, maybe initially from a research KOL point of view, and then in turn commercially?
Yes, look, from we are working with those kind of laboratories already. So we have a number of KOLs that we're working with. We can give them prototype devices to use in their own laboratories and build up confidence in the system. By next year, we will have large numbers of cartridges, so we'll be able to expand that activity and engage many more laboratories in actually using the device and giving us feedback on how it's best refined for their particular use. And then ultimately, we want to develop the fully automated and integrated system so that what we're selling is basically it's a bit like Felix. You have a console and you have a cartridge, And all you do is put your sample in the cartridge, plug it into the device, and it will give you an immediate readout of your antioxidant activity. That's the goal. And that's the goal that we'll be working with our commercial partners to achieve over the next 12 months.
And finally, the status of AI port. David's obviously given a bit of an update there, but where do you see AI port at the moment?
Yeah, I think this is a very exciting development. So we have developed media that will keep sperm cells alive for weeks on end. And certainly from an in vitro point of view, we can preserve the fertilizing potential of those cells for long periods of time. In vivo is a bit more of a challenge, and I think it requires a bit more refinement in order for those samples to be used for artificial insemination. And we're playing with new ideas, totally new ideas. One of the problems when you freeze a sample is ice crystal formation causes physical damage to the cells and hyperosmotic shock. The osmolarity goes up dramatically. We are working on a concept of supercooling cells so that you're able to preserve them at low temperatures, minus 20 degrees centigrade, in the absence of any ice formation. And that should much improve the preservation of their biological functionality. So I think this is a very rapidly developing area, David, and one that we are very keen to participate in.
Just a final question for you, David. In regards to R&D grant funding, is there an expectation on when that may be coming through?
I think that you mean in terms of new grants for us, or?
Yes, yeah, new grants, yeah.
Yeah, probably. I think in the next few months we should be able to access that.
Yep. Now we do have one final question, and I know it's been covered, but I think we should answer it just to close out our Q&A. So why is the Felix equine market target qualified by reference to the non-thoroughbred market?
Well, I believe that there are current rulings, David, where we can't use the breeding has to be done naturally. And John, you may be able to comment further on that.
Yeah, for certain. So yeah, you can divide the equine breeding industry into thoroughbreds and standardbreds.
Yep.
In thoroughbred horses, mating has to be natural. But in the standardbred industry, which is still an industry worth millions of dollars a year, assisted reproduction is allowed. And indeed, there's a great deal of interest now in trying to develop in vitro fertilization systems for breeding horses where the genotypes have been heavily selected and are much in a very high demand. Yeah. So what the Felix device does is it enables us immediately to enter that market and use it to prepare sperm cells for in vitro fertilization of horses, standardbred horses. The Rockstar system, if I could mention that has applications across all parts of the equine industry. And indeed, we are currently working with thoroughbred breeders using the Rockstar device to measure oxidative stress in racehorses so that we can see how antioxidants get depleted during a race and therefore how much supplementation they need post-race in order to bring them back into a state of redox balance. So the horse industry, both sides of it are relevant to Memphasys.
Gents, on that note, we have exhausted all the questions. There were a number, so we got through them all beautifully. I thank you both for your time, not just in presenting today, but also taking the time to go through all the questions that were presented. So, gents, thanks for your time.
Great pleasure. Thank you.
Thank you very much, David. Lovely.
And to each of you for tuning in today to listen to the Memphasys webinar, gaining not just an insight via the presentation of the immense amount of work that the company has achieved in recent years, but also its plans for the future and how it plans to propel itself forward across Felix, Rockstar, AI Port and other opportunities. Thank you for also participating in the Q&A and providing us with such a significant number of questions to go through. Hopefully we've answered them all. If not, you will see David's contact details are there on the screen, and I know he is happy to take any questions directly of shareholders and will direct them to John where appropriate. So thank you everyone for participating today and have a great day.
Thank you.